Good afternoon, everyone. My name is Sally Zaleski. I'm the Executive Office Manager for South Carolina Citizens for Life, and I'd like to welcome you to this afternoon's episode of Proudly Prolife Webcast, a live interview with Dr. Vera Bailey. Dr. Bailey is retired Executive Director of the Low Country Pregnancy Care Center of Low Country, and she comes to us today to talk to us about the assistance that pregnancy care centers offer. So without further ado, Holly Gatling, our Executive Director, will be taking over from here. If you have questions throughout the interview today, please email them to info@sclife.org. That's info@sclife.org. Without further ado, Dr. Bailey, Holly.
Hello, how are you?
Oh, hello, Dr. Bailey. Oh, we're just so delighted to have you as our guest today for the South Carolina Citizens for Life Proudly Pro-Life Webcast. Dr. Bailey brings a rich perspective to the pro-life movement with her nursing background, her doctorate in public health, and her 23 years of service to girls and women facing unexpected or difficult pregnancies who sought the assistance of the Pregnancy Center and Clinic of the Low Country on Hilton Head Island. So, Dr. Bailey, one of the things that really gets under my skin is when folks who call themselves pro-choice issue these utterly false attacks on the pro-life movement, is saying that we don't care about babies after they're born. They say you aren't pro-life, you're just pro-birth. So let's talk about that smear on the pro-life movement coming from people who don't know what they're talking about. Dr. Bailey.
Well, that is extremely false, because the whole idea of us having the pro-life movement is not only to offer services to this woman, but to be able to help her after the pregnancy with the care of that child. Just pregnancy testing and wonderful care and support to these women to becoming a medical clinic. So each woman in 6 weeks of pregnancy cost, except for the labs, which through us was $150, went straight to the lab, to the pregnancy, and after, with support like financial help in case of rent needs, clothing, diapers, food, and taking them through the social service circuit for the babies before they're born. We take care of them after the fact. That's why we became a basic prenatal medical clinic.
And pregnancy care centers have social workers sometimes, but have all kinds of access to help, to government help for low-income women, right, or things like WIC and medical care, free medical care, and things like that. So thank you for addressing that and setting the record straight on what pregnancy care centers do. Now, Dr. Bailey, tell us about your lovely accent and how you got to the United States and involved with pregnancy care work.
Well, I came from, and time is of the essence here, there's so much to discuss. I came from Liberia, off the boat many years ago, after having been educated somewhat in parts of Africa, in Great Britain, and then in the US through the doctoral program. I wasn't particularly looking for a specific type of job, but I found one in Georgia that addressed pro-life issues through the manufacturing of brochures and materials for pro-life clinics, hospitals, whomever wanted this in the United States and then in Canada. After that, I found a job in Hilton Head where I wasn't sure that I was supposed to be. but the Lord made it very evident that's where I was supposed to be. I was giving them 2 years and then moving on to the big bucks and the bright lights. Well, 23 years later before I left. So that's how it came about. And everywhere I went, I picked up everybody's accent until now I have my own. So nobody owns me.
Very good. Now, Dr. Bailey, there is a topic that is near and dear to your heart, and that is the disproportionate way that abortion affects the Black community. And I know you have a lot to say about that. And it's something that the news media, the dominant institutional news media doesn't want to talk about, doesn't want to cover, but you have a forum here, and we're really anxious to hear what you have to say about it.
May I go back in 1 minute to talk about the job? Just 2 points I want to make about the pregnancy clinic where I worked. We had the ultrasound, which, as everybody knows, a picture speaks 1,000 words. I thank God for the one who designed that instrument. May they have eternal glory, because we did not have to say much to anybody because we had the ultrasound. That ultrasound saved many lives. I can tell you anecdotally, about 94.6% of the people who saw that ultrasound were not able to go and complete the abortion. Here is a copy of the pamphlet that we would show them that 18 to 21 days after conception, fertilization, the heartbeat was present, without which the rest of the body could not develop. And as Dr. Seuss would say, a person is a person no matter how small. So this ultrasound would, in the very early stages, that 18 to 21 days when the heart beats, they would see, the women would see a flickering light and go, what is that? And we'd say, that's a heartbeat. Some of them went to the abortion clinics anyway, but they would come back and say, I could not argue with a beating heart. What is beating in my body as I sit here? And they will invariably come right back. Or we might see them later on in the community with protruding bellies and go, yea, God. So that instrument saved lives. Now, I'm concerned as a Black person who has helped to swell the population of African Americans / Blacks in this community because of some of the things that we do that goes against the viability of our offspring and ourselves in the community. Let's start with the fact that we have COVID. Here we have in South Carolina information from DHEC, Department of Health and Environmental Control, that 27% of the population of South Carolina is Black, but nearly 46% of the coronavirus deaths are from Black people. Whites are 67% of the population, and 41 have died from COVID. Therefore, as reflects the national picture, African Americans, Blacks, have a disproportionately higher number of deaths. The COVID testing for positives in South Carolina, positive COVID test, 37% of Blacks are positive. 57% of whites are positive. So why the great disparity? Why this disproportionately higher incidence of sickness and death, morbidity and mortality? Well, some of the reasons are African Americans in general have lower incomes, lower rates, rehabbing a regular doctor, dentist, whatever, poorer health, diabetes, heart, lung, kidney, hypertension, comorbidities as we call them. So they have a higher susceptibility to any virus, despite the fact this is COVID we're talking about. Inadequate diets, too much sugar, too much fat, and not sufficient exercise, then we live in densely populated urban areas generally, where, by the way, I'll come to that, abortion clinics predominate. When these people also, African Americans, hold low income or hands-on jobs from which they cannot easily take time off, they hold jobs from which they cannot work remotely. In essence, they're on the front lines in every area: hospitality, kitchens, transportation, etc. African Americans are in the forefront. So therefore, that is some of the issues. If you live on top of each other in multi-generational homes with no space hardly, how do you socially distance? That's an impossibility. So the numbers continue to rise. Other interesting facts re-COVID is that 35% of COVID dead are female, 65% are males. Why? Nobody knows. The ages most affected, as all of us know, is 60 plus. The average age of COVID death is 76. In South Carolina, youngest to die in this place is 35 years of age and the oldest 98. Of course, statistics change frequently, so lower ages may be shown. Over 420,000 known COVID deaths are given. And how many Blacks are affected? It comes in dribs and drabs from states report. Always the fact is the African American population is lower, but they're disproportionately affected by morbidity and deaths in their community. Louisiana, New York, and even internationally, London, etc. So overcrowding is part of our problem. So social distancing is a luxury. The same goes for the third world countries. When you live on top of each other in ghettos and barrios and slums, etc., how do you social distance? How do you get food to social distance? So these are the problems. So what the government is saying is, of course, stay home and stay safe. Why is it so hard for us to obey? And I would say, when I hear things opening out, Georgia, maybe South Carolina, that we can go to the beauty parlor, really, barber shops, nail salons. People, do yourself a favor. Take care of yourself right now. Nobody's seeing you anyways. Who cares the heck how you look? It's only because of this interview that I even try to look decent today. So regardless of who opens up for your pleasure, stay home, or you might look pretty good in that casket and that mortician is going to fix that hairstyle of your life. Okay, just being silly. I would like to talk about abortion and Blacks, which is another problem. Disproportionately higher numbers of Blacks, not just African Americans, because Blacks come from other countries, Africa, the Caribbean, Haiti, and so on, to swell the numbers in the population. In South Carolina, the 2019 data says there were 4,646 abortions. African Americans and 81 of same. That's why I use abortion rate among ourselves. And the interesting thing is, with the COVID disproportionately affecting Blacks and killing them, the abortion clinics have been allowed to stay open as providing essential services. Seriously? And guess who is rushing to those clinics? My Black people. But you know what? I think most of the problem is that most people do not know the statistics about abortion in America, especially Blacks. Blacks represent about 13% of the population in the US, but provide about 36% of the abortions. According to the Alan Guttmacher Institute, which is a research arm of Planned Parenthood. Black women are more than 5 times as likely as white women to have an abortion. On average, 1,876 Black babies are aborted every day in the US. Therefore, it is estimated that since 1973, with the infamous Roe versus Wade, Black women have had about 16 million, 15.5, one more, 16 million abortions. An activist, Black activist called Michael Novak calculated that since the number of current living Blacks in the US is 36 million, the missing 16 million represents an enormous loss. For without abortion, America's Black community would number about 52 millions, and that's not counting their offspring since the earlier batch. It would be 36% larger than it is. Abortion has cut through the country, the community, like a scythe, cutting down every fourth member. So we have to really look at what's happening in the community. Don't say, because I'm not Black, this is not my problem. We are our brother's keepers, and we have to make sure that any inequities in the system can be addressed. If we go back for a minute to COVID and the fact that so many Blacks die, let's look at the fact that there are many socioeconomic situations affecting Blacks, and there are groups out there who are trying to level the playing field so that not just Black people, poor people, people who need a tangible assistance and can't get them, whether it's housing, whether it's schooling, whatever. There are groups out there, like what my church is doing, called More Justice. And we have other groups out there trying to make sure, some synagogues, etc., trying to make sure that we try to equalize the playing fields. Okay. The death in African American life from different causes since 1973, we have AIDS, we have violent crimes, we have accidents. These account for 200,000 to 500,000 deaths. Cancer, we look at approximately 2.5 million. Heart disease, approximately 2.5 million. And then we jump to abortion. Since 1973, over 15.5, round up to 16 million abortions. And I truly believe this is due to ignorance. A lot of people don't know that abortion is actually legal through the 9 months, 40 weeks of gestation. They really thought it was limited at the first trimester. They don't understand. Not just Blacks, everybody. I had a friend tell me she didn't know abortion clinics were still legal. She didn't know they were still operating as essential services during this horrendous time. So ignorance is not only killing our people, Black people, it's causing the death of American people in general. This is why Black people are a minority. We are not replacing minorities in the community. Hispanics approximately have 3.4 weeks and replace their numbers in their communities. Whites have at least two, replacing that mom and dad in the community. Blacks have less than 1.97, how you calculate that, and are not replacing their numbers. Why we look like we are growing in the community is because of immigration from the other nations where Black people originate. There is a caveat I would like to offer to Black women, is that the high rate of abortions with Black women show significantly high, in a highly significant 1993 Howard University study. It showed that African American women over age 50 were 4.7 times more likely to get breast cancer if they had any abortions compared to women who had not had any. Now, this causes a lot of people very angry when I would bring this out in my work at the pregnancy center, telling people as I gave talks, we need to know this. One woman sent her husband to attack me over the phone. What nonsense you talked at that gathering, scaring women just to get clients. I said, sir, those were not my statistics. I get statistics from people who do the work and then give it out to us. Yes, there is a link, and if you care to have that information, I can certainly give it to you. But there is a link since the 60s with a study that was ordered by Planned Parenthood, showed a link between abortion and breast cancer. This information is coming from Finland, it's coming from China, it's coming from other parts of Europe. There is a connection. And there's a researcher called Professor Joel Brind with the Breast Cancer Risks and Prevention in the Breast Cancer Prevention Institute. And there's a booklet by Dr. Angela Lanfranchi. You may go online and order this yourself or call Polly to give you that link. Any of these things I show, Polly's office can give you that information.
And we're happy to do that.
Yes. So make sure you trouble her, not me. But
no trouble at all.
But this is something that we do need to get out to our brothers and sisters. Again, don't say, well, I'm not Black, that's not my problem. You see, many times we found at the pregnancy center related to abortion, these women were frightened to let their parents know. I know Black parents who would tell me, oh yes, we are pro-life. A lot of African Americans still believe they're pro-life until the rubber hits the road. And then they don't want people to know that they're pregnant, or their children, especially if they're church-based, are pregnant. As Dr. Dobson once said, 3 out of every 10 women in the churches, and much more now, have had an abortion. But the churches are not addressing the problems. They're pretending this is not happening to church-going women. Are you kidding me? The devil wants them more than anybody else. But these are the problems, and it's growing more and more. Unless the churches work with people like Holly, etc., we are not going to be able to address the fact that this is a scourge. We must remember, we talked about the Canaanites sacrificing their offspring to Molech. Hello, people, what do you think we're doing? Molech ain't gone away. He's still very present, and we're still making these sacrifices of our unborn children to a heathen god. People do not understand that in certain communities, like New York, there are more babies who die from abortion than there are live births. And when I helped to man the booth at the South Carolina clinics, South Carolina Citizens for Life, when I manned the booth at the state fair, I had Black people from New York telling me I was lying when I told them that more Black people died than white through abortions there. And more shocking yet, that there's a law that allows a woman to have a full-blown pregnancy delivered, and if she doesn't want it, she can dispense with that child. Now that is infanticide. We've gone beyond abortion. The same kills, okay? But people don't believe, and they told me I was out of my cotton picking mind. Well, many times I am, but in that case, this is national data. I told them, I said, go back home and stop the ignorance. Go and research for yourself. That while we are sleeping sometimes, laws are being passed that we have no clue about them. I remember being in a committee, Senate Medical Ethics Committee, here in a meeting there in the State House. And I was shocked out of my cotton picking mind when they were discussing the dismemberment abortion. I knew about it, but most people have no clue what I'm talking about. That is, a woman has the right to abort her baby now. Ain't that enough? But no, they wanted to pass a law that would allow the doctor to go in and literally pull into pieces that child as part of the abortion process. Which doctor wants to do that? Well, I don't know. We need to be educated about the facts. And we need to call and support groups like Holly's so that we know what's going on in our community. We have, because of the problems facing Black communities, not only does Holly's group help to legislate, along with other pro-life and Christian groups, legislators, try to legislate the end of abortion. But we have people like one, trying to get my brothers, one more, I'll get to it. There's a group in a church that goes outside the abortion clinic here in Columbia, and they're there every time the clinics open, talking
That's a
to
moment of
women.
hope.
A moment of hope. People
Yes.
like this are out there all the time, winter, spring, summer, fall, rain, whatever, telling women they don't have to do this. We need more people out there. We need more support for them so they can run their mission. And we need more physical bodies out there so that they have people that show they're not alone.
Dr. Bailey, there are a number of Black people who are very pro-life and very vocal. For example, Dr. Alveda King, Day Gardner, who's on our board, Dr. Johnny Hunter, the Reverend Johnny Hunter,
Yes.
and most recently, the rap star Kanye West, who has become a vowed pro-lifer, and he's talking now about the decimation that abortion does to the Black community. Are you hopeful that we're going to turn a corner soon? You know, when you get celebrities like Kanye West and Dr. Alveda King, who's the niece of the Reverend Martin Luther King Jr. And they never give up. just like you never give up. Are you optimistic that we will turn a corner and start with the Black community helping to save these precious babies?
The Black community has to take responsibility and gets this message out to them. Alveda King was invited to a banquet in Hilton Head, and she told about how she'd had 2 abortions and was going for the 3rd, and told one of the elders in the King family, he said, oh no, we are pro-life, you will not do this. And this turned things around, ending up she's speaking for pro-life groups to the Black community to let them understand we have a problem. And since, unfortunately, America is fascinated by celebrities, whatever, God bless them, some are positive and some are just feeding garbage to our children. We need more of these people who carry a clout to speak out about these statistics in the disappearing African American community. People, it's not about just Blacks, it's about ending abortion. This is what a Black activist brought to light. He said, since Black America has disproportionately more of the abortions in the country, if abortions were ended today, there's a good chance of ending Roe versus Wade.
Yes.
Had you ever thought of that? I certainly did not. Interesting.
Yes.
So yes, we need the voices from the community, African American, because sometimes information that is sensitive like this must come from the people themselves. As a pregnancy center director, I would always tell people to send the intractable clients to me, read their decision on having an abortion. Because sometimes it took a Black woman to talk to a Black woman. Generally, I had no problem talking to anybody about this. The fact that I loved them in Christ was usually sufficient to win the day. I remember getting into trouble once, very dramatically telling this young Black woman, oh, please don't do this. I will take this child and adopt it until you are in a place where you think you can work with your issues. Basically, I was saying until you come back into your cotton picking mind. But anyway, so she said, I will think about it. I don't know. I said, please. And I'm thinking, what will my husband say when I tell him I've just had somebody coming to give us a baby? But he was used to me. I was crazy with pro-life work. So anyway, I went for lunch and came back and I was greeted with claps. And I said, what are you clapping for? They said, well, congratulations. The client came back. She said she wants to make an adoption plan for you. And I looked up to the heaven again and I said, you know, I was being dramatic. What on earth are you doing here? Anyway, as God is good, we managed to get her to call the boyfriend and he took the child. But it wouldn't have been a bad thing had I had that child because she was a boy and we had only girls. After our 3rd female child, our priest, Irish priest in Africa, said to my husband, Joseph, all I can say to you is, blessed art thou amongst women. So that might not have been a bad idea for me to get a child without going through all the birth pangs. And today, please don't anybody tell me they do not know when life begins. It can only begin at conception. I couldn't jumpstart my pregnancy and start in the 4th month had I wanted to. And when I made this proposal to children, elementary school children, middle school children, just to be stupid, when I gave talks, I said, when I have a pregnancy again, which they're very kind, they didn't tell me, heck, you can't, you're past that age. But anyway, so I would say, I will start in the 4th month and say, nah, you can't do that. You have to start at conception. That's when life begins. And do you know Al Gore and Jesse Jackson were pro-lifers once? They believed in the sanctity of life, but they sold their souls to politics. But at the end of the day, you, me, them, we're all going to answer to a higher power whom we call God. In my ministry, not only did I almost get an adopted child, which was fine, I had Muslim women, atheists, or people who said they didn't believe coming in. And these are the so-called intractable ones that I told sent to Africa. That was me in my office in the back there in administration. And I would always greet them and say, may I pray for you? And someone would say, well, I don't believe in God or I'm Muslim. And all I said, that's not a problem. Hug them, hold them and say, but God likes you. I didn't use Jesus with a Muslim person. That's no way, and that's not the time to talk about those issues. I would simply love them through God and use that name God. I even had a Muslim woman attending our Bible study. And I said to her, honey, you're attending the Bible study, which you don't have to because this is not your faith. We don't want you to feel that we're trying to push you, proselytize you, blah, blah, blah. She said, oh, don't worry about it. This is the only time that my husband will help to take care of the other children at home. Isn't God amazing? Hallelujah. But we do need everybody. All of you out there, if you belong in churches that have Black members, get the pastors to make this an issue to talk about. A lot of pastors knew in the past, and I assume they do, what the pastors were used in the beginning to tell Black women that they didn't need to have so many kids. It was part of the program of eugenics. You can go online and read about Planned Parenthood, for instance, and their eugenic program against Black people. And it flabbergasts me when I see Black people working with Planned Parenthood. Then I know they cannot have researched the origins of this organization in order for them to be standing proud and say, kill the Black babies. Ignorance is costing a lot of deaths in our community. I'm telling you, a lot of Black women do not have the statistics that we have. Some of you out there do. Some of you out there do not. But a lot of Black people don't believe that we are committing genocide with our rate of abortion. Help to enlighten
Dr.
them.
Bailey, thank you for bringing this message out. This video is going to be posted on our website, sclife.org, for people to watch if they weren't able to watch today. I can't thank you enough. I'm sorry we're out of time. We'll have you back. Thank you very much.
Well, thank you for the opportunity to get this off my chest. Be blessed.
Absolutely. Well, thank you, Holly, and Dr. Bailey, Vera, thank you so much. This is a riveting interview. A lot of the comments that have come in on Facebook is that you're just amazing, just wonderful information that you provided for us today, and just keep up the great work. So thank you again, everyone, for joining us for this episode of Proudly Prolife Webcast. We'll keep you apprised as far as what our next webcast will be and who our guests will be. And as Holly mentioned, this episode will be available to those who haven't been able to join us today on Facebook. It will be emailed out and ready within the next few hours. So by this evening, you'll be able to forward it on to your friends and family that weren't able to catch the live interview today. So until next time, thank you. Have a wonderful day. Many blessings to you, Vera and Holly, and stay healthy, everyone. Bye-bye.
Bye-bye.
Thank you, Sally. Thank you very much.
Thank you.